taking a break. She has difficulty recalling information that she just read and asks you for help. What do you do? Okay. Hi, Courtney. How's your studying going?
Good. I've been doing it for like 6 hours straight.
6 hours? Okay, well, let's try. You want to quiz each other? Because I don't know what I'm doing either.
Sure.
All right. So, what is... I don't know. What is a stroke?
I don't know what you're talking about.
Are you feeling okay? Have you checked your blood sugar recently?
No, I feel a little dizzy.
You feel dizzy? Okay, well, let me go grab the AccuCheck and I'll help you out, okay? Don't go nowhere. And just so you know, you cannot get this out of the nursing lab, is what I'm supposed to tell you. Don't take it home with you.
It's for demonstration only.
Alright, so I check her and her blood sugar's low. So what I'm going to do first is I'm going to get her a simple sugar that she can digest really fast to go ahead and get the glucose in her body. Because right now, okay, here's your apple. A simple sugar is like an apple or some orange juice. Something that's a monosaccharide that there's not a lot of bonds that have to be broken for it to be utilized. So after I give her that, it's because her body doesn't have glucose, therefore it's not making ATP, which fuels the body, which means that her brain, that's where the confusion comes from, and sometimes seizures, which is one of our questions. And that comes when, like, the brain, it starts breaking its own cells down, because the body's more concerned with survival rather than function at this point. So I give her that, and then after that, you're supposed to give her a complex carbohydrate. It's supposed to be
Oh, wait, back up a minute, because you want to...
Oh, double check
Yes, what?
her blood glucose.
And how many grams of simple carb did you give her?
15 grams.
Okay.
And you check every 15 minutes.
Which we call the
15 for
rule of 15s.
Rule of 15s is what it's called.
Okay.
Alright, so you keep on checking. And you give her a more complex carbohydrate so it can break down a little slower once you've established the first simple sugar. And then you check every 15 minutes and give her more 15 grams and so on until it's above 70 glucose level, because anywhere from 70 to about 100, 110 is good. And then I think that's everything.
Okay.
Any questions?
So does everybody understand, like on your pre-work question was, you know, I think you explained a little bit about the glucose involvement with ATP. The brain is very sensitive. It has to have a continual supply of glucose for cellular function at the brain level. That would be one of the first things that sort of changes as your blood sugar drops. You probably, even if you're not diabetic, you've probably noticed that in yourself, you know, at times. And this patient is a student who has an insulin pump also going and has forgotten to eat. And so she's really at risk for dropping quite low. We didn't say how low she got, but I mean, she could theoretically get pretty low. So you replace the sugar right away, the simple sugar, because it's faster, okay?
But you always want to follow with a complex carb or simple carb, because if you don't, then the blood sugar will be fine and then it'll drop really fast because you didn't establish the more complex carbohydrate to break down over time rather than just right then and there.
Okay, right, so you get her up at first and then keep her up with the more complex. And it's the 15 grams, check 15 minutes. 15 grams, check 15 minutes. Okay. Did anybody have questions about that? And how your brain requires sugar to function at the cellular level, and the rule of 15, and grab the AccuCheck. When there's a lot of time, when there's a change in level of consciousness in patients in the hospital and you call the rapid response team, this is what they show up with. Because it's one of those quick things you can check right away and see if that's an issue. Okay. Even if patients who are in a coma from hypoglycemia can be brought around really quickly. If that is the problem, they can inject like a 50% concentration of glucose intravenously and really bring that person right back around. It's a simple simple sugar that can be absorbed quite rapidly in a high concentration. So that would be the treatment for somebody in the emergency room who is in a hypoglycemic coma. Okay. All right, good. Bring it a little bit clearer into focus about the brain and sugar. All right. Very good.